make sure to rank all of the schemes, okay? I'll say that again. Rank all of the schemes. Even if there's a place that you don't want to be in the middle of nowhere, still rank it, because you'd rather be in the middle of nowhere than not be anywhere at all. This book will become your Bible. You're going to eat, sleep and breathe GDC standards. It's really sad, but it's gonna happen. Oh, you've got a mesial incisal fracture of your upper left one and it's showing signs of irreversible vulpitis and you're going to need a root canal treatment. What? Don't say that. The patient will literally just look at you like, huh? So once you finished your SJT, you will get an email like this saying that your application status has now been changed to interview. So you have made it to the next stage. Luckily, the interview takes place like a week or two after the SJT, so you have a bit of time to practice and breathe after doing all of that. Different dental schools have different locations for their interview. I'll put them on screen now, so you can have a look to see where you're going to have to travel to. I had to travel to Bristol for mine because that's where Plymouth and Bristol students went. I'd say if you're not familiar with that city, book your transport way in advance, know where you're staying as well, make sure you've planned out your route because you don't want to be late. This is like one of the biggest interviews of your life. It's essentially your interview for your first proper job, so make sure you planned everything in advance. I was lucky I had a friend that I could stay with in Bristol, but if you're not familiar with the city, make sure you book a hotel or Airbnb or whatever you need to do. Just make sure you're organised and you planned it all out. So dress code is also very, very important. Obviously first impressions count. You don't want to rock up wearing, I don't know, some unironed shirt or anything like that. Make sure you've got your outfit ready, and yeah, once you get there, they'll give you a sticker. You pop that on and then you wait in a room with all the other applicants. When you get there, you can really feel the nerves in that room. Everyone's sort of just looking at each other like, you're right, you're right. But luckily I had one of my friends, she was in the same slot as me, so we just sort of hung around together and waited until we were called in. And it is nerve-wracking, so make sure you just take deep breaths. You've practiced, you know what you're doing, you've got this. So yeah, don't expect the interviewers to give you any sort of feedback. They usually have like a blank expression because obviously they're not trying to give anything away. The interviewers are usually educational supervisors themselves or their training program directors, and they've all been trained and they've basically given the same script to make sure that they've all been collaborated to a good standard. So yeah, that's basically what's going to happen on the day, so at least you know now what to expect. Right, so the actual interview in itself, so that's split into two sections. You have the communication in a clinical setting, and then you have the professional management and leadership section. So first and foremost, we will focus on communication. So in the communication station, you have 5 minutes to read the scenario and 10 minutes to act it out. So you have a patient and an assessor in the room. They're both scoring you, by the way. So the patient will present with a clinical problem and then you have to show the assessor that you can basically solve their problem. This counts towards 25% of your overall mark. Luckily, you actually get the scenarios beforehand. So they give you 4 potential communication scenarios that you could get on the day. So you get that a week before, and then on the day you get one of those. So I think that's really nice that they give us the scenarios, because they can literally just throw us in the deep end and give us anything. So at least you have a bit of an idea beforehand of what you're going to get. They also have the mark scheme on the CopDen website, so at least you can know what they're looking for. Again, I'll leave the link in the description box below. But yes, definitely use the mark scheme to practice, because that's the main thing that you're going to need to do. Right, so I will put an example up on screen of the scenario that I got last year during my communications section. I'll let you guys have a read. So feel free to pause the video, have a read, think about what you would do and how you would approach the situation. Maybe you want to write up like a quick draft, and then afterwards we'll discuss it. All right, see you guys in a bit. Okay, so the first thing you need to do here is to introduce yourself to the patient, you know? Just say, hello, my name's Yuande and I'm going to be the dentist that's looking after you today. So something along those lines is really nice, just so the patient knows who you are as well, and you can establish a good relationship from the get-go. Make sure to have a smile and yeah, just try not to be nervous because it can really show in your body language. So just relax and really just embody the scenario. You are the dentist, okay? Another thing is to make sure you confirm their name and date of birth, okay? I can't emphasize how important this is because if you don't, you will lose marks, okay? So yeah, engrave that in your brain, name and date of birth, because there have been people in the past that have forgotten to ask about their name and date of birth and that lost their marks and that could affect your ranking. So you don't want to get a bad ranking because of something as little as that. Once you've done that, you want to also ask them about any allergies that they have, or if they're a smoker as well. That's also really important. Then you can move on to the presenting complaint. So this patient here, they have had an accident. So obviously you want to really be empathetic and really try and get as much information from them as possible. So ask them how the accident happened, if they've been taking any painkillers, if they lost consciousness, to try and get as much information as possible. And yeah, as I said, you get marks for being empathetic, but obviously don't just do it for the marks, just naturally be a caring person because they can see if you're faking it and it's an actor, they'll see straight through that. So just really get into character. Like, we're all dentists, we're all caring anyway, so I'm sure you guys are all lovely and empathetic. So yeah, you don't need to try too hard with that, don't overdo it. If you've got an x-ray, if it says you've got an x-ray in the scenario, hold it up, you know, you don't have to have an actual x-ray, just hold your hand up, be like, okay, so this is your x-ray, you can see here, this is your tooth. So your tooth has 3 layers, you've got the white part, which is your enamel, and obviously so on and so forth. So just talk them through it and show them what has actually happened with the tooth. And then that way you get marks for just being able to describe accurately what's going on to the patient, and you can get the patient engaged. One thing that's also really important is not to keep on talking, because if you're just constantly talking, obviously you've got all this knowledge you want to get out, but you need to really check if the patient is taking it in. So make sure that every now and again you're stopping, you're asking the patient, oh, did you understand that? Or is there anything you want me to explain further? Let me know if it doesn't make sense. So stuff like that is really good because it shows to the patient that you actually care about their understanding rather than you just talking over them. So once you've got all the information, you can then go into the treatment options. It's really important that you don't use any jargon, like speak in layman's terms. I don't want anyone to be saying anything like, oh, you've got a mesial incisal fracture of your upper left one and it's showing signs of irreversible vulpitis and you're going to need a root canal treatment. What? Don't say that. The patient will literally just look at you like, huh? You don't want them to be confused, okay? Don't use all these big terms, big words, because they won't have a clue about what you're going on about. So make sure you're speaking to them in simple, layman's terms that's easy to understand. Once you've gone through all the treatment options, just make sure that the patient is able to decide what they want to do and just leave the scenario feeling confident that the patient is happy, and make sure you've come to a conclusion. That's really important. And bear in mind you only have 10 minutes to be able to reach a conclusion with the patient. So try not to go over that time, because if you just leave it halfway, then it's a bit awkward because you actually haven't sorted out the problem, okay? My top tips would be definitely practice with this one. I can't stress how important it is to practice, because when you actually get the scenarios beforehand, so it would be silly of you not to practice having the scenarios. Me and my friends, there were 8 of us, we lived in the same house together, we literally practiced with each other. We had like rotations, so literally we made like a spreadsheet, a table of how the day was going to run, and we'd practice with one another, get different opinions. At first it's going to feel really embarrassing, you're going to be like, oh my gosh, like everyone's judging me, but honestly, after a couple of times you won't even notice that anymore. At the end of the day, it's for your own benefit. So make sure you're practicing with people. If you don't want to practice with your friends, then find people that you trust. I remember I even practiced with my boyfriend. He didn't have a clue about dentistry, but basically he was the patient, and I just said, look, you have to, I gave him the scenario and he acted it out. And then after I asked for feedback, I said, did you think I was empathetic? Did you understand what I was saying? Were you able to follow? So it's really good to practice with a lot of different people, because then you're able to see how you're doing. And I think that's one of the key parts of this section. So yeah, I hope that helped. And now we can go on to the next section, which is professional management and leadership. Okay, so this is the last part of your interview. Obviously you've done your SJT now, you've done the communication, and then you're doing your PML. So the PML station is essentially a monologue. You get given a scenario, it's like a tricky situation, and you have to identify all the legal issues, the clinical governance issues, how you'd manage the situation, etc. So I'll give you guys a scenario, and what you need to do here is just think about all the relevant issues here. If you know any GDC standards, that will really help here. I'll give you a little hint, and just highlight what you can find from this and how you'd manage it, okay? So again, pause the video, have a read, and then we'll come back and discuss. So the main standards here to consider are putting patients' interests first, communication, consent, record keeping, and confidentiality. There's a bit more as well, but those are the main ones that I'd point out. Obviously, I wouldn't recommend to just list out GDC standards, because anyone can just do that. The main thing with PML is being able to link it back to the scenario and to justify why it's relevant to this scenario. So for example, you can say something along the lines of, in this scenario, it's really important that we consider the GDC standard of putting the patient's interests first, because we have a duty as dentists to protect the patients first and not family. So yeah, find a way to word it, put it in your own words, just make sure that you're linking everything back to the scenario. I'm not going to go into the whole 10-minute monologue now, I'll leave you guys with that. But if you want to find out the full answer, everything that I've got is from the this book, the Dental Foundation Interview Guide, so you can just get your hands on that and have a read. My top tips for this section is to literally learn the GDC standards as soon as you can. I know it's not the most exciting thing in the world, but trust me, this book will become your Bible. You're going to eat, sleep and breathe GDC standards. It's really sad, but it's gonna happen. The sooner you start learning it, the better. Trust me, you'll thank me later for telling you that, because you don't want to just leave it all towards the end. So maybe try and do one a day, or do it before bed or something like that, because you're gonna need it anyway. So make sure you learn your GDC standards. If you don't have this actual book, they might have given it to you first year, but you've probably chucked it under your bed somewhere, you can't find it. I'll put a link in the description box below to where you can find the online PDF copy. So once you've learned all your GDC standards, you can learn your clinical governance as well, the pillars of clinical governance. There's also a lot more legislation that you might need to learn as well. But for now, I'd say over summer, focus on learning your GDC standards. So my second tip for PML is to have a clear structure that you're following, okay? Don't just freestyle it, because that's not going to work. You need to have a systematic order. So list all the ethical legal issues first, all the GDC standards. Once you've listed that, then go on and talk about your management. So think about your immediate management, medium-term management and long-term management. Once you've spoken about that, then you talk about the consequences. So any positive consequences or negative consequences of your actions, okay? So it's really important that you have an approach and you don't just freestyle, because you're gonna start rambling and you don't want that. You've only got 10 minutes, remember, to get all your points across. So make sure that you know what you're gonna say. You get 5 minutes reading time beforehand, so at least you can like sort of plan out and pick out the standards that you're going to use to relate back to the issue. But again, with this one, the most important thing is practicing, okay? Practice, practice, practice. I remember I recorded myself like saying a 10-minute monologue just to try and time myself to see if I was doing okay, and just practice with your friends as well. That was the most helpful thing, okay? So with everything, the key thing I want you to take away is to make sure that you have been practicing, because if you go into the interview and say you've only practiced once or twice, you're not going to feel prepared, okay? So yeah, practice until you're sick of practicing, okay? That's what I'm going to say on that issue. In terms of courses, there are a few courses out there that help and support you with the interview. The one that I went on personally was with the dental training consultants. So they're the people that actually wrote this book that I was talking about. And I found that mock really, really useful. Essentially, it's basically you get a practice SJT and you get a practice interview with real dentists marking you. And there were some parts that I thought I had under control and I was really good at, but going to that mock interview really put things in perspective. And I left there thinking, okay, I need to do a bit more practice. So it was really good having that, and that's something I'd really recommend. If you wanted to go on a course, if you're interested, then you are in luck, because the people that have watched this video, I am going to be offering you a special little discount. So closer to the time when the course does come out, I will have a link especially for you guys. So if you are interested in going to the course, closer to the time I'll have a little link for you guys that gives you a discount off just for saying thank you for watching the video. So yeah, make sure you're subscribed and keep your eyes peeled to the description box where I'll be adding a special link, or just check for updates on my Instagram page. If you're not interested in going on a course, then that's fine as well. There have been people that haven't gone on courses and they've managed to still get a place. So yeah, it's each to their own. If you want to go on a course, that's fine. If you don't, that's fine as well. Just whatever you feel comfortable with, really. So finally, after the interview's done, you can let your hair down. Definitely go and relax, treat yourself, go out if you need to, go grab a cheeky Nando's, do what you need to do because you deserve it. Honestly, November is such a stressful month. So yeah, when it's all done, just relax, it's done. And then in December, this preferencing opens, so you can start preferencing where you want to be in the country. I wouldn't stress about that too much because you have quite a long time to decide. It ends in June anyway, so yeah, take some time to think about where you're going to want to be and rank it accordingly. One thing I'd say is make sure to rank all of the schemes, okay? I'll say that again, rank all of the schemes. Even if there's a place that you don't want to be in the middle of nowhere, still rank it, because you'd rather be in the middle of nowhere than not be anywhere at all, okay? So some people have made that mistake where they haven't actually ranked everything and then they ended up not having a place, and if they had ranked it all, they might have got a place. So yeah, don't do that to yourself. Even if you really don't want to be somewhere, you might as well just rank it, okay? So yeah, so once that's all done, it closes in June and then you'll find out where you're going to be. If you don't get your first choice, honestly, don't be too disheartened. It's only a year at the end of the day, and a year goes by so quickly, so I wouldn't stress. Honestly, just be grateful that you even have a place. And yeah, even if you don't get the place that you want, you can opt in for upgrades. So a lot of people were able to upgrade to a scheme that they wanted, so it's not the end of the world. If you end up not getting a place at all, just hang in there. There might be some people that reject their offers and there might be a space that fills up, so you might end up getting a spot. If you don't end up getting a spot, then you can look at alternative options like doing a year abroad, or I think one thing that you could do at the same time as applying to DFT, you could apply for Scotland as well. Obviously, it's at the same time, so you don't know if you're not going to get a place, but if you want that extra security, maybe try and do the Scotland application as well, just to make sure that you are placed somewhere. And if not, then maybe you might have to just do a gap year and try again the following year, and just seek support from your dental school, because honestly, no one wants to graduate. You've got your BDS, but you're not able to practice. It's not a nice position to be in, and I'm sure dental schools will have so much help and support for you. So keep your chin up. It's not the end of the world. At least you've got your degree, you know, you worked so hard. But yeah, I hope you all get a place. I really do. If you put all the tips and tricks that I've been speaking about into practice, I'm sure you'll all be fine, okay? Just stay calm and do your best. All the information that I've mentioned in this video will be in the description box below. So you can find all the timescales, deadlines on the CopDen website. I'd also recommend that if you're not already a BDA member, you become one, because they send you a little guide called Getting Your First Job, and I thought that was really helpful because they had some practice questions in there for SJT and interview, so that was really useful too. Lastly, I've created my own comprehensive document with my notes and all the resources that I've used. So if anyone's interested in getting their hands on that, feel free to drop me an email. I'll leave my email in the description box below, and I'll be able to give you more information about that. So we have come to the end of the video. Some final words of encouragement. Honestly guys, everyone is in the same boat. Everyone is nervous. No one knows what to expect. So just take it easy, guys. I just want to tell you right now that you are going to be fine, okay? You're going to be fine if you put in the work, okay? Practice, practice, practice. If you need to go back and listen to the video again, please do, closer to the time. But right now, you just need to really just take everything on board, and yeah, as long as you know what you need to work on and you've practiced, you've put in the work, you'll be fine, okay? I have faith in every single one of you. The fact that you've made it to the end of this video even shows that you are a very determined person and you just want to get all the knowledge you can, so that's great. But yeah guys, let me know how you get on. I'd love to hear your progress. If you found this video useful, please do subscribe to my channel, drop me a like and a comment below, and yeah, share with your friends as well. Thank you so much for watching. Thank you for listening. I genuinely wish you all the best of luck. Go and smash it. And yeah, have a lovely, lovely day. All right, guys. Bye.